Hello, everybody. This is Terry with the Premom team for our next panel on fertility and weight. And we have, of course, another great group of experts with us today. We have Brianna Kane, registered nurse. We have Dr. Cara Slater. Thank you. Naturopathic physician.
Hello.
And we have Tina Hickman, nurse practitioner, midwife, and fertility coach.
Hi, everybody.
All right. We had a lot of great questions again from users, so we're going to start with those. We broke them into sets, so each specialist will be talking about those particular questions. If you have follow-up questions while they're speaking, please share those in the Q&A, and we will hopefully have some time at the end to open it up to further questions. So we're going to start with Brianna Kane, talking more about fertility and weight.
All right, so we had a lot of really good questions regarding that. So the first one that we got was, how does weight affect fertility? How and how much? So women who are underweight, overweight, and obese can lead to issues with hormone imbalance, which can directly impact your fertility and cause fertility issues. When your hormones aren't working, correctly the way that they should, it can lead to a number of problems like irregular periods, anovulation, which is a fancy word for just saying you don't ovulate, improper progesterone levels, which would be there to support the pregnancy, and then development of a healthy lining or endometrium for the embryo to attach to. So, and those are just a few things, but those are some of the common things that we see. So all of these problems can directly impact your ability to conceive, and women who do fall in like the obese category do have a lower pregnancy rates overall. So it does definitely affect, your ability to achieve pregnancy. BMI is really kind of the best way that we can kind of determine if you're in a healthy weight range. So you can just Google BMI calculator, and there's hundreds that will come up, and you can, insert your weight and your height, and it'll give you a number, which would be your BMI. So BMI is considered healthy if you're somewhere around 19 to 24. 18.5 or under is considered underweight, and then 25 to 29 is considered overweight, and then 30 and greater is considered obese. So anytime you get far away from that 19 to 24 range, that healthy range, the more problems you're going to have. And so that goes in both ways. So being underweight and overweight, we said 18.5 or lower is considered, underweight. When you get even to about 17, 16, that's when like really serious issues could be happening, like actual eating disorders and that kind of thing. So this is, not just talking to overweight or obese women. It's also talking about women who are underweight. We see a lot of those same issues, that hormone imbalance issues. We're going to talk about some other answers to these questions, and some of them do kind of concern more overweight and obese women, but, underweight women definitely can have a harder time conceiving as well, just because of those hormone irregularities. And someone asked just statistics on all of this with weight and fertility. So the risk of infertility in obese women is about 3 times higher than non-obese women. So it is a significant, difference. And your chance of pregnancy is decreased by 5% every unit of BMI you go above 29. So that's kind of confusing, but, if you're 29, this is your chance of pregnancy. As you go up to 30, it decreases by 5%. As you go up to 31, it decreases another 5%. So every, the farther away you get from that healthy, 19 to 24 range, the farther or the harder it is potential that you're gonna to achieve pregnancy, and the lower your chance of pregnancy is. And then another big statistic that we talk about is miscarriage. Obese women have about 3 times more chance of having a miscarriage versus someone with a healthy BMI. So it is, very, very serious potential to have miscarriages. And miscarriages happen more than we know. We've talked about that a lot in other videos. Miscarriages are very common and sometimes happen, before we even know that they happen. So women, get their regular period, and they could have actually had a miscarriage, and they just, it seems like it is a regular period. But we do know with lots of studies that women who are in that overweight and obese, and especially obese range, do have a greater chance of miscarriage. So it's definitely, it's something to take seriously, And another person asked, does it take more time to get pregnant if I'm overweight? And is there any medical problems? So it doesn't necessarily take you longer to get pregnant, but you do have a greater chance of that happening. Obviously, we know lots of women who get pregnant, and they're overweight or obese. And that happens. It just depends on, what symptoms you're having. If you are having irregular periods, then more than likely it is going to take you longer to get pregnant. Someone who, ovulates monthly is potential to get pregnant faster than someone who ovulates every 3 months. So it doesn't necessarily mean that you can't get pregnant or that it's going to take you longer to get pregnant, but you do have a lower chance of pregnancy rate compared to somebody with a healthy BMI. And that's because of, those issues that we talked about with the hormone imbalance that the weight can lead to. That would consist of, the irregular periods, the ability to create a healthy lining, those progesterone levels that support the pregnancy. So that's just something to think about. We do know that, basically your chance of miscarriage is increased. And once you achieve pregnancy, you do have a higher chance of developing other issues. And this is kind of the kicker. So even if it doesn't take you longer to achieve pregnancy and you get pregnant in that, the first year that you're trying to conceive, that's considered normal. And you do get pregnant, you do have a higher chance of gestational diabetes, high blood pressure that can lead to preeclampsia, having a preterm birth, and you do have a higher risk of having a cesarean section, which with obese women can cause a lot of other issues, like your chance of infection increases greatly, and your ability to kind of heal after a surgery can take longer and result in other complications. So we also see that children born from obese mothers do have a higher chance of birth defects too. So again, it doesn't necessarily always affect women who are trying to get pregnant. You may be able to get pregnant, but then we do see that there are a lot more increased, chances for issues during pregnancy and then from birth. So, it's important to think about. And I say it lightly because we know that sometimes it's really hard to manage your weight, especially people who've had weight issues throughout their lifespan. And I know there's a couple, panelists on here that are going to talk more about kind of some tools and some things to do to, get to a healthy weight. But, when you're trying to conceive, it's stressful. It can be really stressful. And so that can also make it difficult to, lose weight and manage your weight in a healthy way. I live in the Louisville, Kentucky area, and we have several weight management places that that you can go to that your insurance will cover and that kind of thing. So if you're somebody who has dealt with weight issues your entire life and you haven't been able to find anything that works for you, it's okay sometimes to get a team behind you to help you and support you, because it's important. So that's just really this. It sounds like everything that I'm saying sounds super negative, and I hate to be that way, but it's just important to know that it's a serious issue and it can cause a lot of issues. So if you need a team behind you, if you need to seek further, help to support you, I think that's a brave thing. That's saying that, hey, I need help, and it's important to me that I stay healthy so that I can conceive and so that I can have a healthy pregnancy and I can have a healthy baby. So that's just something to think about. Someone else, we touched a lot on this, but how much of a factor is it? This person needed to lose 50 pounds, has regular cycles, and is it affecting her fertility? So having regular periods is a good sign, that you may not have any issues achieving pregnancy. Although studies, like I said, suggest that it could take you longer than somebody with a healthy BMI. But the real concern for a person is, like I talked about, those risks once you do achieve pregnancy, during pregnancy, and then also potential issues with the child, like birth defects and that kind of thing. So it's important to think about. Someone else, I'm going to just fly through this. This one, can weight cause issues with thyroid? I think another panelist is going to touch a lot more on this, so I'll just kind of skim this real quick. Having a thyroid disorder can cause changes in your weight, okay? So it can cause weight gain or weight loss. So it's important that if you do see, drastic changes in your weight, whether it be weight gain or weight loss, to seek some medical treatment or, some testing to determine if potentially there is an underlying issue, like a thyroid issue, that could be the cause of your weight. There are some studies that suggest, though, that small variations in your weight can have an impact on thyroid hormones, like your thyroid stimulating hormone or your T3. So there are some things that potentially, if you have some issues with your thyroid, that weight gain or weight loss can potentially help with. But a lot of times it's the reverse. It's that, if you have weight issues, there is a potential that you could have a thyroid issue causing that. And then the last question that I had, I know you have a question up there that we can get to too, but how does being overweight affect fertility? This person has PCOS. So for that person, I would definitely recommend, we did a PCOS panel, I think last week. I would recommend that they look at that, go back and look at that. You can see that on the Premom app. That goes into great detail about PCOS and has a lot of information on weight. Some of the symptoms of PCOS is weight gain. And so that can lead to irregular cycles. So if you get your weight under control, in some situations with PCOS, there's a lot of variations with PCOS. If you do get your weight under control, then PCOS, sometimes the symptoms of PCOS can kind of dissipate a little bit. So if weight gain is an issue because you have PCOS and it's causing irregular periods and you lose weight, your periods could go back to normal. That's some things. But when you have PCOS, you have PCOS. So there's nothing that you can do that would, make you not have it, but the symptoms can be managed and therefore not have so much hindrance on your fertility. But again, I would definitely look at that PCOS panel because it goes over a lot of information. So yeah, so that was it.
Fantastic. Thank you. And we did actually just have a spotlight with Tina on PCOS. Again, it's a very popular topic. So we've had, I think, a panel, we've done a spotlight or two. Dr. Haby's done some spotlights. It's just very important, I know. So yes, please look up PCOS and Premom Fertility on YouTube so you can check all that out. Did you want to take that question, Brianna?
Yeah. If you want to wait until the end or right now, it's fine. That's perfectly whatever.
Okay, why don't we hold on to it then? And before we move on, did anybody want to add on to anything Brianna said? I know we're all overlapping each other anyway. All right, let's go on then to Dr. Cara Slater with the next set of questions.
Awesome. Well, I think Brianna touched on a lot of the really great keys. So some of this information you'll get several times. So hopefully that will help you all remember it. But the first question that I had was, does being overweight and having diabetes play a huge factor for women having a hard time ovulating and conceiving? And just as Brianna had said, yes, being overweight is going to play a role in your fertility. And we know that when we're talking about overweight, obviously underweight is important as well, but the higher the BMI, really, then the lower the more difficulty you will have with conceiving. And that's just statistically, right? You don't have to fall into that. But getting to a healthy body weight is actually going to be really beneficial in improving your fertility. That being said, diabetes really goes hand in hand with our weight a lot of the time. So with diabetes, we're really worried about blood sugar. And when we have issues with our blood sugar maintenance, it can also have trickle-down effects on our hormones, which can affect cycle regularity. Are you going to be ovulating? And hugely inflammation levels, which is going to affect all aspects of your health and your ability to create that healthy lining, right? To produce an egg when you're supposed to be ovulating. So it is really important to look at not only weight, but also be going to your doctor, getting your blood tests, checking your blood sugar, and making sure that everything is in range. And I also would like to point out that if you do have diabetes, this is not, an end all be all that it's going to make it really hard to get pregnant. What it means is that you just need to get things balanced. So that just means seeing your practitioner, making appropriate diet changes, and making sure that you have, the correct medication that's going to keep those levels balanced. So then another question was really just talking about some general knowledge on how weight is affecting our fertility. And Brianna did touch on some of these as well, so I'll be kind of reiterating things. But on average, about 2/3 of American women of reproductive age are either overweight or obese. So this is definitely a big concern for a lot of women in our country. And maternal obesity is going to be associated with larger babies for their gestational age. It can be associated with prematurity. And I know that Brianna had mentioned this as well, but increased C-section rates. It can also be associated with, I think I mentioned gestational diabetes. And then it can also affect, the just ability to get pregnant, right? So as she had mentioned before, that, for instance, women who are in the overweight category, which would be a BMI of 25 to 30, is going to be a 3% decrease in fertility for that category. And as you go up for BMI of 30 to 35, you're going to have a 14% decrease in your fertility. So it's definitely an important role. But I also want to touch on the fact that it's not just the weight that we're talking about. A lot of times when we are struggling with weight, it's really talking about the foods that we're eating and the diet. So I like people to think of it a little bit more globally, and that are we eating foods that are not necessarily going to be giving us the nutrition that we need, which is in turn going to affect our hormones, and it's going to affect our fertility, and it's going to affect our pregnancy outcomes. So this kind of leads into the next question that I had, which was, how do you deal with losing weight, and is it healthy to diet while trying to conceive? And I'm also going to talk a little bit about the thyroid, but I really don't like the term dieting, because really what I'd like is for my patients to learn healthy eating habits. So this is something where you're going to be able to carry this on throughout, your life, because not only are we going to want to get you at a healthy body weight to get pregnant, but also to have a healthy pregnancy, and then to have healthy, post-term for breastfeeding, and then to raise your children and have all the energy you need and keep them healthy. So my main goal for my patients is to look at what are some really important nutrients that we need to make sure we're getting, and really sticking to a whole foods diet. So that's where we're not eating all these high sugar foods, very carby foods, and that in turn will often help with weight balance. So obviously seeing your practitioner and creating a diet plan that's correct for you, but dieting itself, limiting calories and stuff, that's going to be something you need to talk with your practitioner specifically. But I like to really think of it more as healthy eating habits to create the best foundation for your health, for fertility, for pregnancy. Another question that we received was, how do you lose weight when dealing with thyroid issues and fluctuating hormones? And I know Brianna touched on this and she was spot on, so I'm just going to reiterate it, that a lot of times when we are having issues with our weight, it's oftentimes thyroid is usually more of a cause rather than being affected by our weight. So if you're having difficulty losing weight or you're gaining weight, unexpectedly, there's definitely a chance that thyroid can be off. So I always recommend getting that balanced, and that can definitely help with reaching your goal weight. Now, having extra weight or being underweight can put extra stress on our thyroid, but it's one of those things where usually you want to get it tested and get it optimized, because thyroid is actually really key for fertility and for healthy pregnancy. Our thyroid hormone is basically the metabolism for every cell in our body. So it's keeping everything going. And if that's too low, it can slow it all down. We can feel sluggish. We can be more likely to hold on to that extra weight. And I also like to remind people that when you're growing a whole nother baby and a little human, you need actually even a little extra thyroid. So we really need to make sure that your thyroid is functioning optimally in order to achieve fertility and have healthy pregnancy. The last question that we got was how, on my panel, how does weight influence the amount of estrogen in the body? And this is a fabulous question. So the female body actually, we hold our hormones in fat. So hormones actually kind of come from our fat, and we can hold on to a lot of excess estrogen if we have excess body weight. So in addition to storing the hormone in our adipose tissue, we also can actually sometimes produce more hormone from that tissue. So the adipose, when we have extra body weight and adipose tissue or fat, we oftentimes see higher estrogen levels or more of an estrogen dominant scenario, which can definitely affect our fertility and our hormone regulation and our ability to ovulate correctly, all of these things. So once again, it really just goes down to reaching that healthy body weight is going to improve your outcomes for not only fertility, but also your pregnancy outcomes and then health of your baby also. So it's passed down even to the next generation.
Awesome. Thank you. And it looks like we did get some questions, but we will just save all those for the end and just open it up to you ladies.
All right.
So let's move on to Tina.
All right. So I just wanted to follow up really quickly with Dr. Slater's thyroid discussion. Optimal thyroid by the book, right, is 0.5 to about 5. But when you're trying to conceive or talking about fertility, we talk about optimum fertility thyroid. So I want you to keep in mind that although your thyroid may fall within that normal range, normal to me as a fertility specialist and provider is 2.5 or below. And this is because that's going to give you optimum fertility. When you get pregnant, it's very, very normal. Notice I said when you get pregnant, because you will. It's very, very normal to have an increase in thyroid. So this leaves us a little wiggle room. So when you get pregnant, that thyroid can go up a little bit and still be within the healthy range. So optimum is a really key point when you're talking to your provider about thyroid. A lot of providers aren't aware of this if they aren't in the kind of fertility and reproductive world, but just kind of remind them that, hey, I'm shooting for a goal of 2.5. Because that's super important. So I just wanted to throw that in there real quick. And then to also touch on her discussion about the excess fat and adipose tissue with estrogen production. So like that's hitting the nail on the head, right? So that's an absolutely true statement. But a couple other things that you need to remember is that not only do we store estrogen in there, but having extra adipose tissue is going to increase your androgen levels. So basically the main androgen that we're talking about here is testosterone. So not only are you increasing those estrogen levels to a point where you're having problems, but you're also increasing those testosterone levels. And that can be a really difficult thing when you're trying to conceive. And in turn, that will lead us to things like PCOS and the metabolic syndrome there. One of the major things we test for in PCOS is that high testosterone level. So that's why being overweight is going to put you at a higher risk of having PCOS, because that excess adipose tissue is causing all this increase in hormone. The other thing is the more weight you have, your insulin level is going to go high. So when we talk about things like PCOS, we're not talking about glucose levels here. We're talking about insulin levels. So two totally different things. Your fasting insulin levels will increase as that adipose tissue goes up. And increased fasting insulin is what's going to also put you at risk for PCOS, the metabolic part of PCOS, which usually, causes anovulation and things like that. So as Dr. Slater said, just keep in mind, definitely big deal. When I have a lot of clients who come to me and say, okay, I'm 250 pounds. I understand I need to lose weight, but so-and-so is 270 pounds and she got pregnant. I understand your frustration, but the problem is, as providers, we can't exactly explain that. We can explain that science is happening and that your hormones are changing, but we can't explain why somebody else's are changing differently than yours. We just know that they're greatly affected. So I just wanted to touch on that a bit too. Okay, so I'll move on to a couple more of my questions. Let's see. So I'll start, this kind of goes hand in hand too with what they were saying. So I'll just start kind of at the bottom. Your BMI scale and a good weight for achieving to get pregnant. So again, like Dr. Slater said, we don't really talk about weight. We want to just be healthy. We want you to be healthy, and we want you to eat the right foods and do things that is going to cause more health over time. The other thing is your menstrual period is a really good indication of your health, and this is something that women oftentimes overlook. So if you're 250 pounds, but you have a regular period, you're doing something right. You're working in the right direction. Okay. Sorry. You're working in the right direction. If you're 250 pounds and you do not have regular periods, then you know that your weight is affecting your body in a more severe way than your neighbor. Because once those hormones get kind of elevated, it's going to cause irregularity in your periods. So tracking that menstrual cycle is so super important. Because once you regulate that period on your own, you're working in the right direction. And that's kind of a way to grasp how your healthy eating or exercise or diet is working, is by seeing if that period is regular, because we cannot ovulate and get pregnant if we don't have a period. So that's step one. The other thing is, as far as weight for conceiving, as a general rule, and usually when somebody comes in my office or sees me for fertility and they're overweight, my first goal for them is to lose 30% of your body weight. So that's a little bit easier to think about. BMI can sometimes be really confusing, because, somebody might have a lot more muscle mass, so their BMI is going to be higher. For instance, my husband's BMI shows that he is overweight. He is not. He's built, he's athletic, so it's not always accurate. And I get that. But if you are overweight, usually people know by looking at themselves if they're overweight or not, right? So I usually say if you're overweight or obese, lose 30% of your body weight. When you hit that loss of 30% of your body weight, you increase your chance of pregnancy close to 80%. So that is something really big to think about. And that's a really, really good goal. 30% is a really good key number. And I have had lots of success with patients that hit that 30% goal, and they do have better success. So that's just kind of a little bit on adequate weight to get pregnant and have a baby. Let's see. So one of my questions was, how is losing weight when overweight? How does it impact fertility and pregnancy? And they pretty much already covered this with the cardiac abnormalities, the hypertension, the preeclampsia. You can have clotting problems. So blood clots, especially, that increase for cesarean section goes up, which is going to increase your chance for blood clots, which is going to increase your risk for death. So you need to remember that. Also, increase in recurrent miscarriages, increase in stillbirth. So a lot of your risk of carrying a baby to term and then being born as a stillborn child increases. Diabetes, gestational diabetes, your risk for diabetes down the road after pregnancy is also increased. So those were just a couple more things that we touched on. And, when we talk about when we talk about the risk of being overweight, we also have to talk about the risk to your child, because that's also really, really important. So you're looking at, if you have a child preterm, you're looking at NICU time, you're looking at this baby maybe having glucose problems when it's born, you're looking at feeding problems, you're looking at NICU stays, you're looking at a harder, unhealthier time for your child. So when you start to think about conceiving and having a child, you have to also think about your baby, not just yourself. So when you come in to see us as providers and we tell you to lose weight, it really is out of concern for you and your future children. So I just wanted to touch on that for a minute, because I know that, women get really frustrated when all they hear is lose weight, lose weight, lose weight. It's super frustrating. And we get that. We don't like to tell you that, trust me. But the reality is it is so important. It's so important. And we don't want to see you have to go through that problem. Okay. So the next question that I have is thoughts on weight and diet and keto. So first I'm going to say, which I told these girls before we started, keto diet is not my favorite, probably my least favorite. Okay. So the reason is because, again, like Dr. Slater said, we are not looking to, if you change the food you're eating, you're still eating calories, whether it's calories from carbohydrates or calories from protein. You're still eating calories. So when you're talking and when you're trying to get pregnant, there's certain vitamins and nutrients from the entire food pyramid that we want you to have, right? Not just certain foods. So if we want you to be nutrient balanced, certainly watching calories is more important than eliminating certain food groups, if that makes sense. So I like to okay. I need to start by saying my favorite kind of diet, or lack there of diet, is just calorie counting. So, things like Weight Watchers, stuff like that does a good job, but you can count your calories on your own. So calories from, there's a couple studies out that say, we should get a certain amount of calories from real protein and a certain kind of calories from carbohydrates. So when I say protein, I'm sorry. When I say protein, I mean lean and plant-based protein. Okay. So as a general rule, if you can get 30% of your diet in protein, and then 40% of your diet in carbohydrates, slow carbs, right? Then you can kind of just watch your calorie intake with all other foods of the pyramid, and you're going to have a pretty healthy diet. So foods that you want to avoid: artificial sweeteners, caffeine, fish with high mercury, so things like shark, king mackerel, those kind of things. Non-organic meat and dairy is important. Skim milk. There's actually been some studies recently that say skim milk is not good for fertility. So, and that's actually one of my favorites. So that's something I had to quit too. And I will say I have seen a difference. So I think if you're trying to conceive or trying to get healthy period regulation, you may lay off the skim milk a little bit. So as far as weight loss, or as far as exercise goes, so I had a question about, let me see, if high intensity weight loss and strength training was good or bad when you're trying to lose weight and get pregnant. So yes and no. So this kind of exercise can be good in small amounts. But I actually addressed this a little bit on my last panel. When you talk about things like CrossFit, there's a reason CrossFit is so hard. And it's because it's hard on your body. It's not easy. So hard weight training and stuff like that is not necessarily a good idea when you're trying to regulate hormones and regulate things in your body. Now, strength training, so slow strength training with weights and stuff like that, that is okay. But I would stay away from the high intensity stuff when you're trying to conceive, and definitely why you are getting pregnant, why you are pregnant, because we don't want you on any kind of diet while you're pregnant. Eating healthy and exercising while you're pregnant is a wonderful idea. And this is going to give you a better birth process. This is going to give you a decreased risk of C-section. This is going to help so many things if you just watch those calories and watch your diet. However, the high intensity stuff is just not a good idea. Something else I wanted to touch on is, let's see, where is it? So exercise again. So when you talk about exercise and weight loss, I have people that come into my office all the time and they're like, I walk 3 miles a day and I haven't lost a pound. Okay. That's very true. And that's super frustrating. But what these people don't understand is in order to lose a pound of weight, you need to burn 3,500 calories. So that's a lot, right? So on average, 3,500 calories is what's going to give you a pound of weight loss, or a deficit in calories. So if you're walking, but you're not walking to increase your heart rate or for cardio, you're probably not going to lose much weight. It's actually, it's just going to basically balance out the food you ate for the day. So for maximum weight loss, you have to burn those calories. And the way you do that is exercising to your target heart rate. So that is really important. And that is something that I try to get my patients to understand. So you can get your target heart rate by taking 220 minus your age. And that is kind of your maximum average heart rate. So if you're exercising, you want to reach for that target heart rate less about 20 is going to be your range. So for instance, we'll say, a 30-year-old, right? So your target heart rate then is going to be 190. So you're going to shoot for a heart rate range of 170 to 190. So if you're out walking and your heart rate's only 115, you're not burning many calories. You need to get that heart rate up to burn calories for weight loss. Super important. So on average, for a diet or healthy eating or calorie counting, you need to cut 500 to 1,000 calories a day to lose 1 to 2 pounds a week. So you really need to think about, when you're diet and exercising, you need to think about counting calories, not changing your foods. You need to think about target heart rate. You need to think about cardio versus strength training versus high intensity training or walking. Okay. So, and your provider can talk to you more about this. I do a lot of diet and diet planning in my fertility practice and in my women's health practice. So I go in a little bit more depth than all people probably need to know, but this is really important when you're trying to count calories and lose weight. The other thing is when we talk about foods and calories, don't eat foods that are so calorie dense, right? You may be able to go out and have a huge meal that is the same amount of calories as that bag of chips. But if you want the calories from the bag of chips, eat it. But when you're trying to get pregnant, you need nutritious calories. But the same calories, calories are calories one way or the other. It's still a unit of measurement. It's still energy, and you're still going to have to burn them off. Let's see. I think that's it for my questions. Unless anybody has any follow-up.
Does anybody want to add on before we jump to some questions? Okay. Thank you, Tina. Let's see, it looks like we had 3 questions. And thank you again to all 3 of you ladies. I really learned a lot today. I always do. I love how you really break things down for us. Our first question was, how can I increase my progesterone level when I'm obese and it is low?
I can answer that. So first of all, this is kind of complicated, but a progesterone level is hard to really be determined whether it's low or not via a blood test. Okay. And the reason for that is that there are so many variations with women of their progesterone level. Also, your progesterone level fluctuates a ton in a 24-hour period. So when you test it with your blood that one time, that may not be a great indicator of what your progesterone level is overall. So someone could, just an example of this would be, someone goes on to have a healthy pregnancy and they have a progesterone level of 10, okay? Whereas someone else could have a miscarriage with a progesterone level of 15. Okay, so there's no really indicator that tells us whether your progesterone level is 100% normal or there's a problem there. It's really hard to determine by blood. So if there are issues or if you're concerned about it, one would be just like when you have regular periods, your progesterone should be developing. When you ovulate, after you ovulate, your progesterone level rises and continues to stay elevated until your body determines if it's pregnant or not. If you are pregnant, then the progesterone level continues, and that's what supports the pregnancy early on. If you're not pregnant, then that progesterone plummets. So if you have a normal, regular cycle, technically you should be developing an appropriate amount of progesterone. We do know, though, that there are women who don't and needs progesterone supplementation. And so the way to do that would be just to be on progesterone supplementation. And usually that's started, right after you ovulate. Some people say, if you have a normal cycle, it's kind of based off of that around the time when you typically ovulate, and you would start it after you ovulate and continue on it daily until you find out if you're pregnant or not. And get that period. So progesterone supplementation is something that you can get. An OBGYN can put you on it. If you're seeking fertility treatments, a lot of times they use it. So that would be more of if you're having irregular periods, then it's a potential that you're not developing the progesterone that you should. So seeking kind of the normal weight and that kind of thing would help those symptoms potentially. And then if further on from that, if you're having regular periods and you're concerned about your progesterone levels, then there are progesterone supplementations that, are very simple to use. There's a lot of them, a lot of different kinds that can be used. And like I said, it's just going to require that you kind of seek a medical professional for that to get some guidance on that. The good thing is that whether you have progesterone issues or not, you can be placed on progesterone supplementation and it doesn't hurt anything. So that's the good thing, is it can only help. It doesn't really hurt anything, even if you do have a normal progesterone level and you were to use progesterone supplementation.
Thank you. And what I'm hearing a lot from what's being shared today is that there are so many factors. I know we're talking about the whole picture. Dr. Slater talked about the global picture too, that there's so many factors that go into trying to get pregnant. And it's really about talking with your specialist, looking at all the different factors. And even though certain things may not play in for you and may for others, it's good to see all the information and make the best decision possible, because we want to be successful and get pregnant and have a healthy baby. Okay, let's see. We had a question about someone who has a high BMI now, and if they get pregnant now, if they continue to work out and lower the BMI, could that reduce the risk of complications during delivery, like preeclampsia or gestational diabetes, I guess? Or is she asking, is it too late?
Yeah, so I can touch on that. Absolutely it does. So like I said, there's actually been some really good studies on exercise during pregnancy and its wonderful effects on delivery, and postpartum recovery and things like that. So absolutely, if you continue to exercise and do things to help your body, it is good for you. It's good for baby. It's good for all outcomes in general. So don't get discouraged. As long as you're working towards that goal, you're going to decrease your chances of all that stuff. If you're eating healthy, if you're exercising and you're doing these things, it benefits everybody all the way around. You're always getting more benefit if you're doing something, right? The person laying on the couch isn't going to get as much done as the person that's up moving. So any kind of movement toward the goal is fabulous. Absolutely.
Fantastic. It's good to hear. And then, got a thank you. Okay. Then we had a question, what if I'm overweight, but I'm exercising, I'm eating well, just like you ladies have all talked about. My lab work is normal. Would there still be a concern about problems? Just this person's concerned about such a focus on weight, though everything else seems to look good.
I can speak to that one. And I think that Terry honestly kind of just gave us a good intro to that. And really, it's not all about the weight, just that specific number on the scale, or as Tina had said, the BMI, that is not an end all be all. And, like Tina had said, the BMI can be misleading for certain people, right? There's such a range of different body types and physiques. And some people are more tall. They've been more muscular their entire lives, and that the BMI doesn't necessarily fit for their health level. And just the same as the scale is not, those numbers are not determinants of your health. Now, generally speaking, if you are overweight and it's affecting, health in any way, of course, reaching an ideal weight is going to be important. But I think a better way to focus on this and a better way to get outcomes that are going to be positive overall is looking at your overall health. It sounds like if you are eating healthy and really making sure that you're getting a high nutrient content diet with adequate levels of, I'm big on the protein, which Tina had kind of mentioned as well, with adequate levels of protein, and you are exercising, you're getting good movement every day, and your labs are looking good, then, I think the focus is don't stress yourself out about just the number, that weight piece, because that is not the end all be all. Are you getting, do you have good nutrients on board? Is your cycle regular? Because sometimes hormones can be, off, even if your weight is looking really good and you're doing everything right. And that's where maybe you want to make sure, yes, you're tracking everything, but you're getting your labs done, you're seeing your practitioner. But don't focus all on the weight. Look at overall being healthy, balancing your hormones. How's your cycle looking? Are you moving your body? Are you eating a healthy diet? And all of those are going to be huge indicators, more so than just that number on the scale.
Awesome. Thank you. And we did just get another question in. So we're going to take this last question and then we're going to wrap up because we're at the end of time here. So this one looks like it's kind of at the other end of what we were just talking about, Dr. Slater. This person is having irregular periods, has always had irregular periods, and finally just got off birth control. Now they're having more of a regular period, but not ovulating. And they're wondering, is this a concern? They are on the obese side per BMI.
Yeah, so I can touch on that. I was actually reading the question too. And I saw and I just talked a lot about this in my spotlight yesterday, actually, about how the effects of birth control on your period regulation. So I would encourage you to maybe watch that. But anyway, so as a general rule, combination oral contraceptives, right? So a birth control pill of estrogen and progesterone is generally not going to affect your ability to conceive in the future. That's actually one of the ones that sometimes we use for period regulation to kind of prime that person getting ready to have a child or to try to conceive. When you're talking about an IUD, so there's a couple different kinds, but if you're talking about a hormonal IUD, those hormones are just progesterone. So a lot of times when you get that taken out, it can actually prolong your menses from coming back. So that can be normal up to about 6 to 12-ish months, usually no more than 6 with Mirena or Liletta. But if it's been over that period of time, you just got a couple periods, you're having some irregularity, I would definitely go see your provider. I think that at this point, probably figuring out what the underlying cause of this irregular menses is. If you are on the obese side, then again, we're talking a little bit more about these hormones that are getting released and possibly being elevated from the excess adipose tissue. So those hormones could be what is affecting your irregular periods, not necessarily your Mirena or your birth control that you were on. So I would actually urge you to go get some blood work, get a testosterone level, get some insulin levels, get some estrogen levels, get some things like that, and kind of see where you are on the hormone range. You know, a lot of times anovulation, irregular menses, obesity, these can be kind of the first 3 steps to developing PCOS. And again, PCOS is not curable, as Brianna said, but PCOS is treatable. So we can treat you to be able to conceive, but I definitely would try to work on that weight. Decreasing that weight is going to get your periods back the way they need to be. But again, weight is not everything. Seeing what your hormones are is going to be beneficial, because on the double-edged sword that we always talk about with PCOS is I am obese, so I have PCOS, but I have PCOS, so I'm obese. So those things work against each other. And a lot of times when you are overweight and you have PCOS, losing that weight is so much harder. So treating the underlying hormonal problem, the insulin levels, the testosterone levels, can actually aid your body in weight loss as well. So I would definitely see your provider and get some blood work done to kind of check those insulin levels and see if you need treated for anything metabolic. I would love to talk to you more about it. I can go so much in depth with the possibilities and what could be your problems and what could be going wrong. But that's just kind of a general blanket.
Awesome. Thank you. That was really nice that we actually had that juxtaposition there with those 2 questions. That worked out great. Thank you, everybody, for participating. Thank you again, ladies, for all of your wealth of information and your insight. And I just want to remind everybody who's watching this that you can find all 3 of these ladies right in the Premom app. They are fertility specialists. They're ready to help you. If you go to more in the bottom right corner of your app and schedule a consultation, you can see our list of providers. And if you resonated with what was talked about today, please make sure to check with these ladies. They can give you very personalized information about your chart and some possible next steps if that is something that you think you could benefit from. So thank you again, and I'm sure we'll see you all again soon.